Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
Okay, I have a fun one for you here.
Okay.
I want to know what your thoughts are, and maybe we can dialogue this from the practice owner standpoint and then also from an employee standpoint.
Okay.
But when is it appropriate to ask for a raise?
Mm-hmm. Okay, so do we want to talk about it from the employer side first, or?
Yes, because I'm going to tell you why I'm bringing this up. Okay. And so I know the doc who asked me about this is a listener, so in order to make sure I protect her privacy and whatever, so I might kind of dance around a little bit here, but bottom line, she had an employee that was applying to dental school.
Okay.
And so while they're waiting, like they took their DAT and now they're waiting to start their applications for dental school, this person, and maybe even had a couple of college classes left. I feel like that was me too, actually. And then I had, I was like, well, if I'm getting into this field, let me look into being an assistant. Back then, I didn't have to do anything, right? Like I could go to an office and say, hey, can you train me? And so I think that's what this person did. Like somebody, a colleague of my colleagues said, hey, I've got this person, brand new RDA, she's applying to dental school. And so she wants to just experience what it's like.
Yeah, for a short period
of time. Yeah. So this colleague of mine said, okay, sure. And hired this person on as a sterile tech. And I guess that's the colleague who reached out to her was like, well, she's observed in my office and she helped us with sterile, a couple of days on a busy day. Like we would just say, throw on some gloves, take this tray back. So not real experience, but just some like knew what instruments were and knew how to turn around a room. And so this colleague of mine was like, okay, well, I'm going to pay you like a sterile tech. Let's assume the amount was $10 an hour.
Yeah.
And, so I think this candidate, this pre-dental, was like, yeah, I'm going to work part-time so that I can kind of, like, the whole goal was just to say, well, as I'm getting ready for dental school, if I can observe procedures and if I can help in turning around rooms, like, yeah, they have their RDA, but they don't really have any skill set per se.
Gotcha.
So it was more just like, can I be in the environment and listen to the conversations of treatment planning and listen to how, and turn around rooms and do whatever. So this colleague hires her $10 an hour. The candidate is happy enough with that because the candidate's goal was to gain experience. So my colleague calls me and she's like, well, it's been 6 months. And the candidate came and said, well, now I've learned I know all the instruments. I can set up a room for op. I can take x-rays.
Mm-hmm.
So, can I get a raise? Because I'm doing a lot more in your practice.
Mm-hmm.
So I know what my thought was, but I want to know what your thought is.
So my thought is no. No, you can't have a raise. So this is me strictly from a consultant standpoint, by the way. And again, being a consultant, I do feel like I'm in that in-between all the time. I'm constantly advocating for my clients, of course. But to me, part of advocating for my clients is also advocating for the team members. That goes hand in hand. They are mutually connected. However, when I'm thinking about this scenario from a consulting standpoint, I am looking at a client of mine, a dentist, a practice owner, that has taken a risk to hire a short-term employee. Now, sure, from a consulting standpoint, a short-term employee is challenging on multiple levels. So it's challenging in that we don't want to have to invest a ton of time and energy, because training any team you talk to, a team that's constantly training somebody new is a tired team. They're very tired. They get worn out in the training process. It's just a lot. There's a lot of teaching and coaching and correcting. And
I mean, even we only let pediatric residents come observe in our office, and I'll let there's a preceptor program that I remember as a dental student was vital to me.
Yeah.
And so I've paid it forward. And so every year they contact me, can we send a student who's interested in being a pediatric dentist to your office? And we just had one over Thanksgiving break, and it was exhausting. And he wasn't even doing anything. He was just shadowing us. But, you know, he was asking questions like, wait, why did that parent say that? Or we're going to come back and do an episode on it. We had the last day right before Thanksgiving, like the last 2 hours, we had 2 very difficult patients. It was very defeating. And then I've got this student on top of it that's like, what in the world just happened? Why would you handle this way? And so for us to have those conversations, just to even talk to an observer,
it's extra
exhausting.
energy.
It's
Yep.
exhausting.
It really is. And a lot of times I could understand why a short-termer may not realize the amount of effort and energy that's going into bringing them on board. But it's a very exhausting process. Training anybody, short-term or long-term, is exhausting. So we've got that. And for a doctor to choose to make that investment for somebody that he or she knows is going to be short-term, I as a consultant would recommend to that short-term, don't ask for anything. Like, they're doing you a favor by giving you a job for this short period of time. So that would be number one. Number two is there's only so far you can take a short-term person. Even if they end up doing more. So let's say it's, 6 months before this person's applying to dental school. Heck, even a year before somebody's applying to dental school. There's only so far that you'll be able to take this person. Because from a consulting standpoint, please, for the love of God, do not invest all this time and energy into promoting this person up through the ranks, and now it's harder to replace that person. It's somewhat easy to replace a sterile tech, but if we start moving that sterile tech into complex levels of assisting, and now we become reliant on that short-term person to fulfill that role, well, then when she does get into dental school or is ready to move on, which we knew from the get-go, we knew it was going to be short-term. Well, now we're having to fill the complex role that we kind of moved her up into. So to me, with any short-term employee, my advice to my clients or to my practice owners is don't wear your team out with this person. Just put them into a role that they can learn, and when they're not doing sterile, they can step in and watch a procedure. They can listen in at the front. I still want them to get the benefit of exposure to things, but I don't want to exhaust the team for somebody that's only going to be there for 6 months or even a year. And then my other advice to people is please don't advance them to all these high skills that now you are reliant on them for. It's okay if you're doing that in conjunction with somebody else that's still going to remain when this short-term person leaves, but oftentimes that advancement happens because they need somebody to fulfill the role, and they were like, well, shoot, bring up sterile tech person and she can step in and become an RDA. To me, that's where I get really nervous because I know this person is short-term. So for those two reasons alone, unless your colleague has somebody that has completely flipped roles, she said, screw it, I need a solid chairside assistant, and I know it's short term, but she's going to be our go-to chairside assistant for the next 6 months, and I know it's only 6 months. If they're doing that, very consciously moving her into a different role, knowing that it's going to be short term, but they're requiring a lot more out of her, then I would say, okay, well, sure, pay the person more if that's what you're doing.
Okay, so a couple of the things that came up with this, which is why I wanted to bring it up with you. So I don't think they are necessarily moving into another role, but so maybe it's happened inadvertently where now this person can take x-rays, and now they can seat the patient, and now they can whatever else they're needing her to do. And so she's like, I'm not just a sterile tech. I am now moved into the role of I guess she's not helping in major procedures, but say hygiene. And she's helping in hygiene. So that is kind of a role shift.
To me, it would need to be a distinct new role. Like, hey, we have hired a new sterile tech. We are moving you to chairside assisting or to hygiene assisting.
So the argument that we got into was, but you are doing more. I as the owner am benefiting from you taking x-rays. And my thought was, well, you've learned on my dime.
Right.
You've learned on my... But the argument was it doesn't matter because that person is now able to have a skill set that is benefiting my office.
So I guess this is where I have to switch to employee mode, because I think it's hard to talk about this without switching over to that. So from an employee standpoint, the only reason why that practice owner would have to be thinking about a wage increase, I would think, is because the employee asked for it. So to me, it begs the question, and I want to respect your colleagues' privacy here. So from the employee, you shouldn't be asking for a raise, I guess is where it needs to come back to. Because even if you are now taking x-rays, your whole goal, it sounded like, was to get the exposure and some training that you needed to be able to be more successful in dental school. And this person, this practice owner, is kind enough to let you do that. So yes, you came in as sterile tech and now you're learning additional skills. But to me, if I'm the employee and I know I'm trying to prep for dental school, I should want to get all those skills, as many as I can in the 6 months or 12 months, whatever it may be. I should want to add all those things to my tool belt for my own benefit.
But if it's also benefiting the practice, why can't I get paid a little bit more too?
To me, that is an irrelevant side task. If your whole goal is to get in and get experience. Now, it'd be different if you said to me, hey, I've got this dental assistant that came to me, and she may be going to dental school. It's one of her goals. It's a long-term goal.
No. This is a definitive short-term. I'm only here part-time, and I will be gone.
So to me, no.
Okay. So I guess that, to me, that's I guess the argument that I was hitting up against with not with the colleague that hired the person, but just in general, as I was kind of talking about it. To me, that was the thing, was, well, this person is doing more in your office. Shouldn't they get an increase? And I was like, no, they're doing it for their own benefit. Yeah, but it's benefiting you too. And I was like, yeah, but from colleague's standpoint, she's the one who took the liability on to bring you in and was okay with giving you just part-time and short-term. So it wasn't even just short-term, it's part-time short-term.
Right.
And so I was like, they've already made a lot of accommodations.
Right.
And, I guess the person is smart. The RDA is smart. Like, she's getting into dental school. She's already, she will get into dental school.
Yeah.
So to me, the fact that she was able to pick up on x-rays quickly or pick up on other things quickly, she's a quick study.
Yeah.
And so now is it the office is getting penalized for you? I don't know. And so I kind of see the point of, yes, it is benefiting the practice, but I'm like, well, when you look at it as a whole thing, I didn't hire you to begin with. I hired you as a favor to my colleague.
Yeah.
And made a spot for you and worked up training you. So then the question that came up, because there was actually the colleague, and then there was another colleague that we were talking, and it ended up being this discussion. Was the so at no point should this person ask for a raise, and my take was no. So even at the year mark, no. If the plan is to leave, unless they have changed their mind and said, RDA is my calling.
Correct. That's different.
But if this is still like, yeah, we got into dental school, but I didn't realize the start date was July and not April.
Right.
You know, so I should get paid more those 3 months. No. The agreement was still,
Yes.
the goal was you should be. So that was part of it. The other big part of it was like, to me, I don't think anybody should ask for a raise in any field, wherever you are, earlier than a year, because they say it takes 2 years for you to really get to know your role and really provide, value to the place of employment. And yes, then you go back to, well, of course I provide value. I show up and I call the patients, or, I show up and I'm at Walmart and I check the patients. Of course I provide value. You wouldn't be able to see these, these customers wouldn't be able to buy stuff if I wasn't there checking them out. Yeah, but that's what you get paid for. So I don't know. It got into very much all of that kind of, and I was like, I don't think anybody like truly knows the place they're working at for at least a year.
Correct.
And I don't think it's
nor their role.
Yeah.
Even if it's more of a cut and dry role like RDA, I think this is where people get confused a lot, because they show up and day 1, they do certain tasks. Day 14, those tasks look very similar. They may be a little bit quicker at them. Day 30, day 60, day 90, they're doing the same task, but they're getting better at them. They have less questions, faster. And so what they may trick themselves into believing is that once they get to 6 months or even a year, to be perfectly honest, that they have grown so much that now they're more valuable to the practice. And I would posit, and I think it's worth our listeners to really stop and consider this. Is it that you're more valuable, or that you're just now earning the value that was ascribed to you on day 1? That to me is most often the actual truth, is that we made an advance to you of, yes, we will hire you on. We've done as much vetting as we possibly can to think that you're going to bring some value, and we're going to give you a dollar amount that we think is commensurate with that, or even a dollar amount that you've requested. And then it takes you a solid 6 to 12 months to even prove that you're worth that. So to ask for anything before a year, I think, is very premature. I don't care how many new skill sets that you've added in that period of time. If you are brought onto a team, you should, for that first year, be adding all new kinds of tools and tips and tricks and efficiencies to your tool belt. That is the expectation, which is why you received the pay that you were given. And I think a lot of employees trick themselves into thinking who they were on day 30 is commensurate with the pay. And so therefore at day 365, when they feel like they're a completely different employee, they feel like now they're owed more. And I just think, I hope that listeners will hear me when I say this. I think we've got to change our mindset. And we've got to recognize that the dollar amount that was given was actually a leap of faith for that doctor. And you need to be grateful for that.
And the doctor is the one who had to hope and catch and watch and train and guide and make sure the even if you came in being a Tour de France winner, but now you're on my track and I need to start you on training wheels, because even though but you don't know the ins and outs of my track. And so as I'm making sure you're not going to fall off the cliff edge, because you're used to the Tour de France's things, but you're not used to mine. You're going to pitfall there. You don't realize there's quicksand over there. You don't realize there's a flood coming at you there. So I'm going to have to help you navigate through all that. And yes, you got a gold medal, which was worth $30 an hour in your biking days. Fine, I'll give you $30 an hour, but you're doing $30 an hour with training wheels with me for the first 6 months.
Yeah.
And you're making some strides and you're going, but it's still, by the time you finish the race, I'm just glad you finished it, which was the assumption that you were going to get there. So I agree completely with you. Now I can see where employees would be like, what? I I contribute on day one. You wouldn't be able to see these patients without me, but that's what you got paid for. Like
Yes.
and there was a certain amount of training that went into, this is how we do it in our office. This is how, I still remember one of mine that was offended that I wanted to schedule intraoral photo taking with her. And she was just, and I had like my seasoned people. So in my mind, I'm like, I'm paying a hygienist, hygiene fees to stay over lunch to practice with you. Mm-hmm. And your response is, I already know how to do that. I don't know why you're wasting my time training. And I should have known then that we had issues, because you're a person who has such an inflated ego right now that you can't even see that the training is an investment in you.
Right.
To where I directly had to tell her, honey, anybody can take an intraoral on a good 8-year-old.
Right.
You come take an intraoral on the 1-year-old by yourself, then you are proficient in my office.
Right.
So, but the fact that I even had to say that to her, that she had such an inflated ego, and I'm like, why? What? And we've had nothing but issues for 2 years with this person, because every few months she'll get into this, well, I blah, blah, blah. And I'm like, you are the one with the least amount of experience in this office. You're going to go toe to toe with the person who's been here for 7 years? Like,
right.
How dare you?
Yeah.
And she doesn't see it at all. Hey, listeners, I have a thought for you. It is nothing new. You've heard me say it before. I believe it was season 3. It was one of my favorite taglines. I'm so pleased with myself. And I figured it's coming back. It's very applicable right now. If you have not signed up as a subscriber, my thought for you is, you're the problem, not me. We have all these resources for you. We've got the bonus episodes. We've got the digest that's just phenomenal. And you're hesitating, and I don't know why. You don't need the help. You're your own coach. Like, you're going to just take yourself to the top because you don't need any extra help or resources. So if that's the case, you are the problem, not me. Okay, stop fooling around. Go sign up. The other question I just remembered that I was going to ask you. So this was the other point of argument between me and colleague and the other colleague that kind of stepped into the conversation. The other colleague that stepped in the conversation was like, what is the harm in asking for the raise? Like, what's the harm? Like, all that the initial colleague can say is, no, it's only been 6 months. No, you're a part-timer. No, you're not getting a raise. And that's the end of that. I viewed differently. Colleague didn't know what to think. She's like, I don't know. Like, is there harm? Is there not harm? So I will start by saying, I think there is harm, but I wanted to hear what you think. Is there?
So, it's a very logical thing to say. You know, what is the harm in the person asking? But I think when we're talking about, and this is where I'll get on a little bit of my soapbox, to me, the dental field itself is full of dental professionals. I do not care what role you have. Sterile tech, RDA, hygienist, business office, I don't care what role, dentist. We are a professional field. We do a job that is exceedingly important in my book. So we have to not think about the worker mentality, we're sitting in IKEA parking lot, the IKEA employee or the Ashley Furniture, whoever, I don't care. We can't think like an employee. We have to think like a professional. So what is the harm in asking for a raise is an employee mindset. It says, let me see how much I can squeeze out of this. I mean, might as well. What's the harm in that? But when we think like a professional, that question doesn't feel as appropriate. Because now we go, no, I'm a professional and I'm a sterile tech and I took on this role because I have a goal of getting into dental school. I have a lot to learn. I am on my professional track. And I'm in an office that has thankfully accommodated my schedule and is allowing me to even go beyond sterile tech, to learn new skills like taking x-rays and seating a patient and taking blood pressure. And man, those are skills that I didn't think I was going to get, but on my professional track, this is valuable. So when we think about it that way, and then we throw in the question, well, what does it hurt to ask more money? That is not the track of a professional. That is a track of an employee. How can I get more out of this while I'm in it? And then we have set aside the goal of, let me see how many skills I can earn, because I've potentially thrown a curveball at this dentist. And now this dentist is going to look at me differently. Because now, rather than being this young, eager, early in his or her track professional, that I get the benefit, even though I'm making a lot of accommodations. I'm working this person part-time. I'm paying this person for a position that I really didn't even need. So I'm making an investment in this person from a time standpoint, money standpoint, and I feel good about it because I'm helping somebody along in their professional track. So it's kind of a give back type situation, and I feel good about that. Oh no, wait a second. I've actually got an employee on my hands because he or she just asked for an extra couple dollars. Now I'm thinking about this differently. Now I feel less good about my investment of time and energy and the accommodations that I'm making. Now I've got to look at this person as an employee, not as a professional that will one day join the ranks as a dentist alongside me. That's the harm in that.
Well, and I guess to me, I didn't even think about that, but you're right. Because to me, I'm like, wait a minute. I was letting you take x-rays and do all of this other stuff for your own learning. So I was, facing, can I risk it here? Is this mom going to go, why did I have to take this x-ray 3 times? Am I going to deal with that kind of situation with a parent? Or am I going to have a relaxed parent that's going to be like, oh yes, this is a young up and comer, let her practice on my kid. So I've got to watch all of that. And in my mind, it's like, yeah, I'm helping you grow. And what that's turned into is, okay, well, maybe we should slow your growth, because if you think that every new skill you have, I'm going to have to pay you more for, well, that one in my budget. The whole point was to help you grow.
Yeah.
So I think that I hadn't even thought about. Like now I'm like, no. You're not going to go sit and watch op. You're not going to go help set up op. No. Stay out of the front. I don't want you helping anywhere in the front, because what that's going to turn into is you turning around and saying, oh, well, now I can answer your phones. And I guess from their viewpoint, they're going, but it's a help to you if I can help you in op and I can help you there. But I'm like, but you're not really a full-blown help, because you're not going to stick around a long time. I'm not going to give you the challenging cases, because that's going to mean, like, if normally, yes, you can take x-rays on the good 8-year-old, but I'm not going to throw you into the 3-year-old that's going to give up. I'm going to pull my seasoned person to do that. Now, maybe I might have the seasoned person help you so you can start getting some practice. I'm not doing that anymore, because now I'm paying 2 of you to do the job. Yours was supposed to be a growth mindset. Now you've turned it into a dollar amount employee mindset. I know exactly. You've been able to phrase that in a way I wasn't able to reconcile in my mind. I think for me, where I took that was, okay, but if this person, like part of me, if I was colleague, now who knows what colleague's thinking, she may never want an associate or whatever, but to me, I'm thinking if I had let that person in my office going, they get to see my office, they get to know my office, they get to know me, they get to know the culture, they get to see some procedures and see how we handle it. They'll go see whatever they see in dental school. And when they come out, maybe I'll be ready for an associate.
Right.
Maybe I'll be ready to retire. And this is a person who, because we've worked alongside each other and we liked things about each other, maybe this could be. And I'm like, but if that, now I feel squeezed.
Yeah.
That's the word you're saying. I feel squeezed. And to me, I'm like, oh, that's your mindset. Me. What can I get out of this? So if you come on as an associate, what are you going to demand at that point?
Yeah.
So to me, there is harm. And that's the way I was arguing that there's harm. And the other colleague that stepped in was like, but there's no harm. If you don't want to give them a raise, don't give them a raise and move on. And I'm like, but the color of that person has changed for me. The situation.
A paradigm shift. Yeah.
Yes. And my mind has changed now. So I guess that's for this one specific example, but I guess to me, to make it more universal for our audience, to the basic question of, like, when should you ask for a raise? So I think we've talked about here already, maybe at the year mark, any sooner is,
ill-advised.
Ill-advised. I think remembering that whatever you ask for at the beginning, you're probably only starting to earn that at the year mark.
Yeah.
I think, so this was the other question I was going to tie in with this, and then we can get back to, again, if you have any other broader advice to that situation. But it made me think of a colleague of mine, and I hadn't thought about this in forever until this conversation came up. And he has said that if somebody comes to him and asks for a raise, he will tell the person, he will say, okay, you're asking for a compensation review. Just so you know, like, your compensation could go up or down. Mm-hmm. So I'm going to start asking questions to see, like, do you show up on time? Are you a pain in the butt with this? Do you whine about that? Does somebody always have to come back and make your trays for you? Are you the one that is constantly like, oh, forgot the spatula, forgot the burrs, forgot, like... So I'm going to start digging and asking all those questions. So your pay could go up or down.
Yes.
And just so you know, all the people in my office that are the highest paid, or the people that have been here the longest, none of them have ever asked for a raise. Why? Because I see their value, and I give them the raise before they have to ask for it. Mm-hmm. So if you are confident that you are ready for this compensation review, and he has said, which blows my mind, he's like, so what that does for you? Because in my mind, I'm like, but then you're going to lose the employee. And before I could even say that, he's like, you go into that going, is this an employee you even want? Because one, they're trying to ask for something and say, I'm valuable, which we're good about noticing their value ahead of time. Now, again, if you're a doc who you're like, I'm not giving a raise until somebody asks for it, then maybe that's another problem unto itself.
Ill-advised as well.
That's ill-advised, right? So to me, I start going, okay, who would stick around? I was like, have you? And he's like, I've had one person stick around after. And he's like, we lowered her pay by $2 an hour.
Yeah.
But at least it gave her a sense of knowing, like, this is what I need to do to
step up,
which is just mind-boggling to me that anybody would stick around. But he's like, if you are going to go through this process and see that you truly have undervalued this person, hopefully that's a lesson to you to go, you're lucky that this person asked before they just walked away and you were none the wiser. He goes, but if you discover that this person, he's like, don't you want them out of your practice? Because they're overpaid for what they're doing and they want more.
Right.
So I just thought that was very, I wanted to say that to this colleague. Unfortunately, the conversation was already over, but I was like, hey, maybe that's what you should do with this person.
Yeah.
Is say, hey, okay, well, we can look at that, but are you sure you're
ready for it to go up or down?
Yeah, because you could end up at 11 or you could end up at 8.
Yeah.
So you want to go through this process? Which I just thought was mind-boggling. I don't know that I could ever do that. That was so, like, brilliant to me. Brilliant.
Yes.
But if you could speak to, yes, from the doctor standpoint there, and also are there times that it is appropriate for an employee to ask for a raise?
Yes, I do think there are times that it's appropriate. Now, first of all, like we just mentioned, I think it's very ill-advised for there not to be some type of annual compensation review. Because I don't like for employees to be in the place where they feel like they have to ask. Because, number one, that's highly uncomfortable. But number two, it also forces them to think about compensation a whole lot more. Because they're trying to figure out, is now the time? Should I wait another month? What about? They're constantly thinking about it because it's this unknown mile marker that they've got to figure out. And I don't think that's a strategy.
Well, I would think you would start going, asking around and going, what do you get paid? What do you get paid? Well, what do you have to do? What are your hours? So it's like by not knowing, and for the doc to just be like, well, I'm not going to give it until they ask. They may be asking around and they may, like, leave.
Yes.
And you never had the opportunity.
Exactly. And a lot of people will leave before asking for a raise. They would rather switch jobs than to go through the discomfort of having to ask for a raise. So I just think it's not a smart strategy to have. So docs, annually you need to review compensation. That does not mean annually raise. Let me make that really clear. I'm not saying every year somebody needs a raise. That is not my recommendation. You just need to know, the employee needs to know they have a time and a place every year to review compensation.
Which, can I give a spoiler alert here? In the digest this month, we're going to have tips on how to do the compensation review.
Yes. You need these tips. You need to know how to do a compensation review. So sign up, subscribe for that. So from an employee standpoint, though, I do want to speak to that because ideally, your doctor has a compensation review in place, so you don't have to worry about it. You can wait if your doctor has a compensation policy in place that he or she sticks to. Please don't ask before. That is put in place for a reason. And so if there's an annual review, you can wait. I don't care what new role you've assumed, what new tasks you've taken on, whatever the case may be, you can wait until that compensation review. So if your practice has something like that in place, I would highly advise you not to ask for anything outside of that time. Now, if your office does not have something in place, to me, what solicits a raise is new role or new job duties within your current role. So this is going to sound harsh, but to me, value does not come from longevity in a practice. So the longer you stay, if you're doing the same role and you're providing the same benefit to the practice, you should make the same thing year after year after year. That is my perspective. And that may sound harsh, but Bob at IKEA, I can guarantee you, if he stays in his exact same role, doing his exact same thing, my guess is that he would make a marginal difference between day 1 and year 10 if Bob is doing the exact same thing. Dental has done this very wrong, and they've rewarded longevity. So Susie does the exact same role every year and does it the same way, and somehow she makes $10 more 10 years from now. I think that's wrong. So unless you are providing more value to the practice in either becoming way more efficient at your role, which has then enabled you to do more things, or you've completely changed roles in the practice. You went from Sally the receptionist to Sally the treatment plan coordinator and case closer. Okay, that's a higher skill set. I get that. And in that case, as long as you're doing a good job in that role, you should earn more. Now, this is where I need to say something too. Just because you took on the new role does not mean that that should immediately come with a pay raise. You need to prove yourself in that role before you ask for any compensation for it. So I understand that you're like, oh, but I went from receptionist to treatment plan coordinator. Yes, but know that there's at least 3 to 6, maybe even 12 months of investment that doctor is then putting into you, which has value, and you need to absorb all that training. And then when you're a really good treatment plan coordinator, then you can ask for an increase. But I do not like the mindset of
I feel like every office, it's just expected. You're about to go into this role, and here's your raise for going into this role, and you haven't even proven yourself.
Yeah,
you haven't even proven if you've turned around and made that value back for the practice.
That's right. Yep. So that would be my advice. First of all, if there's a plan in place, don't ask for a raise. And then the only thing that should solicit a raise request is you are literally bringing more value to the practice, either by what you're doing or by doing more of what you're doing.
Okay, so that's what I was going to ask. Like when we went from a 4-person front desk to a 2-person, that warrants potentially a raise because now 2 are doing the job of 4.
Correct.
Okay. Assuming they are doing the job of 4.
Assuming that they're doing the job that the 4 used to do.
Yes. Okay. And then do you have advice for, like you said, if the practice has in place when they do their review? So if you don't have that, can you talk to doctors who like the benefits of that maybe, or how to establish that, or what do you do?
Yes.
Because again, I think I went ass backwards into mine. It's not like I walked in going, for me, you helped do that. And we've over the last 6-7 years, we've kind of had that. And I think we do have the benefit of longevity of employees, such that when somebody new starts, the others will say, you don't need to ask. They are fair about giving you the raises. We don't have to ask. They go ahead and give it. They watch out for this. So if you don't have that built in, culture, how do you establish that, I guess, is the question.
You've got to start somewhere. So to me, it's just a matter of deciding, okay, it's been advised that I need to review this on an annual basis. So when am I doing that? Picking a time that makes sense for you. It doesn't have to fall at a certain time of the year based on what we recommend. You and I get together with your team every February. The reason that we picked February is because we can look back by that point at the previous year, the entire year. So this February of 2025, we will be able to go back and look at all the numbers of that person's pay for 2024. So it's all the numbers are done by your CPA, and we've got everything prepared. We have a month essentially to get it prepared by the time we sit down with them. It doesn't have to be February. It can be August every year, because August is a slow month for you. And then your year for that employee would just run August to July. So whatever your year mark is, just make sure you're reviewing the previous 12 months. So pick a time that makes sense and just schedule it and prepare for it. Again, in the digest this month, we've got a very particular way of preparing for compensation reviews. You need to have a strategy for it. You can't just sit down and be like, okay, Betty, so you make $20 an hour. How do you feel about that? Are you wanting to make more? I mean, it's got to be like, what's the data that you're bringing to that meeting to show Betty what she makes? Reminding her of all the benefits, talking about her goals. Does she want to make more? Okay, let's figure out a path where you could make more. This is where you could really bring more value to the team.
So I can see a doctor going, what the hell, I'm supposed to bring up how you make more? I don't want to pay you more. So I think where that's worked out in our practice, though, has been like, so I think the assumption is everybody wants to make more. But by you asking that, what you're really asking is, what else can you do? Mm-hmm. Are you a one-trick pony in this practice? And if it comes out that is, then maybe the person can kind of know their place, I guess, a little bit. Because we've got one that is more or less, or this was a few years ago, but she was more or less a one-trick pony. And, when she came in wanting more, it was like, okay, well, one thing you could do is, are you willing to learn this, or this? Oh, you're not. Okay, so we're going to stick to the same things you've done. So that just makes it really clear. I'm not picking on you. It's very objective that you're willing to not pick up anything additional. You're comfortable in your comfort zone, which means you should be comfortable with your pay. The second thing that comes out a lot of times is, well, when we track everybody else's hours over the last year, everybody made around 1,600 hours, worked 1,600 hours. You were showing as you worked 1,250 last year.
So there
growth. Was the work opportunity. It's not like we only had 1,250 hours available to you. Everybody else was able to get in the 1,600, 1,650 hours. So you're not a part-time employee. Oh, you were just absent a lot. Okay, mm-hmm. So if you just show up to work more, you'll make more. So I don't want anybody to get scared off of that question, because I think the gut reaction is, what the hell? I'm going to ask you want to make more? First of all, of course you want to make more. But second of all, is that like a tee up for me to say I'm paying you more and then I really don't? And so now I've tricked you? All of that. It's actually a pretty strategic question.
It really is.
It really is.
And it's yielded some really good conversations for us over the years with employees that we've had, because we've either been able to direct them into, okay, if you're staying in your exact same role, this is how you make more. And oftentimes that is working more, which thankfully is available to them. Or you may not know that Betty wants to grow in her role. She seems perfectly content being the receptionist. And you're like, oh, I didn't realize that you wanted to grow financially. Now that I know that, what are some things that you're interested in learning in the practice? And we can see what we can do. Well, I've always wanted to learn insurance. Betty, I never knew that. That's fantastic. So it can lead to conversations that are productive for the practice and ultimately for the employee, but it also ties compensation to performance, which I think is critical. It's one of the benefits of asking that question. Are you satisfied in your role and with your compensation, or are you wanting to grow in both your role and your compensation? They are intricately connected. And so it sets a really good environment for, if I want to earn more, I have to learn more in the practice.
And you may risk losing somebody, because I think that's what happened with this employee. She wanted to make more, but even when we pointed out the hours that she didn't work, she still didn't pick up more hours. She did nothing to change that. We did try to train her to do other things. Maybe it was insurance or something. And she was like, I'm not comfortable doing this. So rather than her recognizing in herself and going, oh, well, then I am getting paid fairly, she quit.
Yeah.
But then she came back a year later because she was like, oh. So then once she saw what else was available, like, yeah, you're really good at that one role, and it is an important role, but everybody else in the office is either working more or they are learning other skill sets, and you've gotten very comfortable where you are, but why? But then you're asking basically for me to raise you just because you've been here.
Right.
And that's where you get that longevity piece. And I'm like, I can't do that because I'm not doing that with anybody else in the practice.
No.
Last question I have for you is then for the docs, do you have docs that are like, I'm not giving a raise unless they ask?
No, not any current clients that would say that. It's just the wrong mindset. And I am really blessed to work with really awesome people. And to me, a mindset like that shows, and this is going to sound harsh, a mindset like that shows that you do not value your team. And thankfully, I work with great people now that would not ever say that. And so to me, if you're saying that, you are on a slippery slope of having chronic turnover in your practice, not being able to accelerate your practice where you want it to go because you don't value the people that are helping you get there. So
well, that's the conversation that came up with my colleague and this other was, I'm like, what this person's asking for is basically a very transactional thing. I learned how to do this, I should get paid more, but what you've missed is the relationship and the investment and the opportunity that has been given to you to come into the practice. Yeah, but they're helping you with your sterilization, they're helping you with set up rooms, they're helping you file claims, like to scan them in, they're helping you with all of this stuff, so they are benefiting your office. Don't you seem like the selfish one that you're just taking advantage of this person? No, I wouldn't have even had this person here because of all the accommodations being made for somebody who's not going to stick around and how exhausting it is to train. To me, that was a relational thing that I'm investing and paying forward for you, for your growth, to be a successful dentist one day, to be able to see. And I'm very proud that you are trying to see what all it takes to run a practice and be, see beyond just the technical dentistry. And you've made it very transactional here. And so I think that's the same thing I would say to a doc that's like, I'm not giving a raise unless they ask for it. You're making it feel very devalued, and you're making it feel very transactional. Like, what you bring, okay, fine, I'll give you $1 more, but only because you asked. Like, it's not a good feel.
It's not. And it's worth the investment of time to have these conversations. It's worth the investment of money to reward your people that are bringing more and more and more value. To keep them motivated, they do have to experience some of that value for themselves. And thankfully, these people are often intrinsically motivated. But you should reward the people that are helping your practice to grow and to thrive, and to have the mindset of, I'm just not going to give any until they ask. It's very transactional, and it is not a recipe for success in my book.
Okay, well, we were all over the place there. I hope we answered the question for the broader audience of when is it appropriate to ask for a raise. I don't think we missed anything, did we?
I don't think so.
Okay, if we did, y'all let us know.
Yep.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone. But we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.